อย่างเดียวต้องน้องมันยังไงวะเพราะตอนนี้ถ้าปล่อยถ้าเสียงเข้าอันนี้จะไม่ออกนี่ถูกไหม
南非社会发展部祖鲁部长阁下，
เอที่
มันก็จะเข้าด้วยเหมือนกันใช่ไหมใช่เพราะว่าคนที่พูดอย่างเนี้ยคนในซูมต้องได้ยินในนี้พูด
ใช่ต้องได้ยินที่
ถ้าสมมติว่าเราเปิดอันนี้ไปด้วยมันก็จะกระซูมพร้อมกัน
ซูมดังชี่เนี่ยเพราะตัวนี้มันเข้าไปอยู่ในซูมนะเดี๋ยวเสียงในซูมชื่อ
เอาไม้ลงตรงเขาหน่อยครับเอาไม้ไหนใช้
ได้กี่ตัว
ใช้หมดเลยครับ
มีกี่ตัว
เอ้าอะไรอ่ะ
Test 1 2 test.
Oh, okay. So the money then. Yeah. Well, on behalf, I don't know, on behalf of His Excellency, Mr. White. Because we cannot. Yeah. Supposedly the money can speak, but on behalf of the chair, the chairman of the DPPN. Excellency. Good sir. Professor Damani, what is your title? I have to make sure that we have to correct. And I congratulated him for the UN. And I believe we do more with the UN also. They are very capable. Okay, solo lahat na complete na. It's okay?
Excellency, Art Director from the UNFPA, and I will moderate the session. So, he's an old friend of ours. Oh my God. Yeah, wonderful to work with them. Yeah, no. That's what we hear. But
Excellencies, ladies and gentlemen, we are awaiting the arrival of the Vice President of Zimbabwe. Once His Excellency is in the room, we'll start the panel.
Excellencies, it's so nice to see everyone. We're told that, yes, it's so good to see you again. For the lighting, yes. Hi, my sister. Thanks for hosting. We're told that the Vice President is just coming up the steps. Vice President is about it. So I'm just going to briefly take my place. Hello, my dear friend. So His Excellency the Vice President is almost here, so I'm just waiting for him. Arthur, this is me. Go to speaking. Senegal. I come in a region. Welcome back. You're working. And you? The work is going on very well. Thank you.
My brother, how are you? Good, good, good. How are you, my brother? Good. Yeah. Your Excellency, good morning.
Excellencies, ladies and gentlemen, it's really my honor to call this panel to order. This is the Ministerial Panel on South-South Cooperation for Family Planning. It's a session that we'll have for an hour and 20 minutes. And of course, there are also people who are following this session online. It's really a pleasure on behalf of UNFPA to welcome all of you here, in particular, of course, the distinguished panel that we have today. In particular, of course, the Vice President of Zimbabwe, His Excellency Dr. Chiwenga. But also, we have the honor to have with us Jose Rimon, the Chair of the Steering Committee of course, the ICFP. Just a little bit of a recap. This panel will really showcase how countries are actually leveraging South-South and triangular cooperation to enhance the capacity of national agencies and other organizations in providing family planning services. And the panel will therefore provide programmatic inspiration and policy guidance in strengthening existing SSTC partnerships and finding new ones for family planning. During this session, by the way, we'll have some questions. If they could not be answered due to lack of time, we'll ask the audience, of course, to then mail them to the office that will give you that site where you can mail in your questions. But we hope we get to the point where we can have questions from the audience. My name is Arthur Erken. I'm the Director of Policy and Strategy in UNFPA. And without further ado, it is my honor to invite His Excellency, the Honorable Minister of Health and Family Welfare of the People's Republic of Bangladesh, Mr. Zahid Malek, to give his opening remarks. Mr. Malek, the floor is yours.
Thank you very much. I welcome you all to this ministerial panel, South-South and Triangular Cooperation for Family Planning. Let me start by thanking the moderator for this session, Mr. Arthur Harkin, the Director of Policy and Strategy Division in the UNFPA. It is an honor and opportunity for me to chair this important session. I extend my sincere thanks to PPD Chair, board members. We have the Vice President here of Zimbabwe, ministers, EXCO members, and participants for their gracious presence. I expect with the nice cooperation of all present here, this session would be enjoyable and fruitful. It has been quite a while we couldn't meet physically due to COVID-19. Our prayer to all whom we lost and suffered. Now we want to bounce back and make up the loss incurred. I take the honor to introduce today's honorable members of panel. We expect them to deliver their valuable speech, keeping in mind the time allotted for convenience. I also would appreciate vibrant participation from the audience with comments and questions. To introduce myself, I'm Zahid Malik, Minister of Health and Family Welfare People's Republic of Bangladesh. Thank you very much. Thank you very much. Then we have with us His Excellency Dr. C. Chiwanga, Vice President, Republic of Zimbabwe. His Excellency Dr. Yu Zhejiang, Vice Minister, National Health Commission, People's Republic of China, who would be connected virtually. So he is not present here. His election, then we have with us His Excellency Dr. Dereji Dugoma, State Minister, Minister of Health, Federal Republic, Democratic Republic of Ethiopia. And then we have with us His Excellency Dr. Hasto Wadoyo, SPOG, Chairperson, National Population and Family Planning Board, Republic of Indonesia. Present here? He's present? Yeah. Then we have with us Dr. Leticia Adele Apia, Executive Director, National Population Council, Republic of Ghana. Then Dr. Suwana Chai, Watanyang Charo Chai, quite big name. Director General, Department of Health, Ministry of Public Health, Kingdom of Thailand. Then we have with us Dr. Natalia Kenham, Under Secretary General of the UN Executive Director, UNFPA. There is one name, I don't know whether he is present or not, His Excellency Mr. Amos Lugo Lobby MP. Oh, I see. Sorry. I'm neighbor. Well, you can, sorry about that. You know, one thing I remember, as they said neighbor, you can change your wife, but you cannot change your neighbor. So how can I change my neighbor? So, His Excellency Mr. Amos Lugolobi MP, Minister of State for Finance, Planning and Economic Development Planning, people of Uganda. So now we have finished our introduction. Now let me say a few words myself
Absolutely.
Regarding this session, regarding the overall situation and a little bit of my country's situation. So bear with me. At the request of the Honorable Minister Lindiwe Zulu, Minister of Social Development of South Africa and the PPB Chair, it is indeed an honor to chair the ministerial panel on South-South and Triangular Cooperation of Family Planning session of the International Conference on Family Planning. Today is a special day, a milestone day with the birth of the Earth's 8th billionth inhabitant. So we have got the 8th billion inhabitants. So one more added to the already big number. It is a day to pause and take stock of whether population growth is an opportunity or a burden, and to interpret the resource management of our planet, nationally or globally, given the various forms of inequalities. Compounding the latter are emerging challenges of climate change, political instability, and threat to global peace, and also including COVID-19 that at the moment under control. The relationship between population growth and sustainable development is complex and multi-dimensional. Rapid population growth makes eradicating poverty, combating hunger and malnutrition, and increasing the coverage of health and education system more difficult. Conversely, achieving the sustainable development goals, especially those related to health, education, and gender equality, will contribute to reducing fertility levels and slowing global population growth. Today, two-thirds of the global population lives in a country where lifetime fertility is below 2.1 births per woman, roughly the level required for zero growth in the long run for a population with low mortality. In most countries of the sub-Saharan Africa, in parts of the Asia and Latin America and the Caribbean, the share of population at working age between 25 and 64 years has been increasing thanks to recent reductions in fertility. This shift in the age distribution provides a time-bound opportunity for accelerating economic growth per capita known as the demographic dividend. To maximize the potential benefits of a favorable age distribution, countries should invest in the further development of their human capital by ensuring access to health care and equality education at all ages and by promoting opportunities for productive employment and decent work. Uh, Regarding the Bangladesh experience, effects of COVID, war, and calamities have disastrous consequences to health. It hampered health, education, and economy in many ways. We stressed upon education and counseling of youth and mother to adopt family planning and reproductive health services, strengthen law for protection against violence. GOB Bangladesh government is providing mother and child adolescent health services through FWC, that is Family Welfare Center, and special corners in hospital and community clinic free of cost. There is regular visit by family welfare visitors and family welfare assistants, giving counseling on family planning, nutrition, and ANC and PNC. We are encouraging to have delivery by trained person like midwives at clinics, hospitals. C-section are in the increasing trend in the private sector, about 60%, which is alarming, and we are trying to reduce that. Postpartum hemorrhage is one of the major cause of death. We are giving misoprostol tablets for it and also building awareness. Child marriage and low weight babies are causes of death, even due to home delivery, which is still about 40%. We gave incentive for institutional delivery. We have employed trained person like community skilled birth attendant and midwives, arrange vaccines and 24-hour services and free ambulance services for the pregnant mother. In all major hospitals, we have installed SCANU, special unit for the low-weight baby, like an incubator for distressed newborns, and it is saving lives. Mothers are practicing kangaroo mother care in hospitals. GOV, Government of Bangladesh, is giving financial assistance to lactating mothers. Our outcome is CPR, contraceptive prevalent rate is 62%. Total fertility rate is 2.1, which was about 4% nearly. And CPR was around 40%, now it is 62%. Population growth is 1.1 to 1.2. Mother's mortality rate is 163, and child mortality rate in the 5 is 28. Ladies and gentlemen, there are currently several efforts to enhance South-South and triangular cooperation. For instance, with the support from China, Bangladesh is engaged in a program to reduce maternal mortality by addressing postmortem hemorrhage. PPD recognizes the importance of involving young people in SR-HR program as critical for development. In order to promote a youth-centered approach and ensure effective participation by young people in South-South cooperation, PPD, with support from UNFPA, has launched a platform for young people to engage in SSTC called the South-South Youth Platform. PPD is also facilitating member countries to review progress with the implementation of the Nairobi Summit commitments. To this end, the Secretariat is supporting the establishment of the National Task Force in member countries like South Africa, Ethiopia, India, Pakistan, Senegal, and Vietnam. South Africa provides scholarships for students and global study to study population policy. China provides several $1 million of family planning commodities to several developing countries, and Tunisia provides support for family planning training to the Francophone countries in Africa. India contributes generic drugs and has become the global pharmacy of the South. There are robust South-South institutional mechanisms existing to provide technical assistance in population and family planning. This includes in the South-South International Interministerial Conference on Population and Development that is held routinely to intensify the exchange of information regarding population policies and family planning programs. To organize South-South technical cooperation on family planning education, innovate safe motherhood and family planning programs, and to establish programs for the production of medical supplies and commodities for the family planning programs. So, I like to shorten it, it is so big. I therefore like to underscore the need for PPD to mobilize resources and to engage inter alia governments, international organizations, and the private sector in support of South and triangular initiatives to sustainable development. In this respect, promoting South-South and triangular cooperation is essential to advancing family planning goals and is a critical milestone to ensure universal access to sexual and reproductive health services and rights by 2020, as laid down in the Sustainable Development Goals. Ladies and gentlemen, with these remarks and few other remarks, allow me to give the floor back to the moderator. Thank you for the patience hearing.
Thank you so much, Your Excellency, Mr. Malek, for setting the stage and really highlighting the successes that Bangladesh has had over the years, and of course also how South-South and triangular cooperation has benefited the family planning program in Bangladesh. It's now my honor to invite Dr. Natalia Kanem, the UN Under Secretary General and Executive Director of my organization, UNFPA, to deliver her keynote remarks. Natalia, the floor is yours.
Thank you very much, Arthur. Mr. Chair, Your Excellency, Mr. C. Chiwenga, Vice President of Zimbabwe, Excellencies, Honorable Ministers, distinguished panelists, dear guests, dear friends, I greet you in the name of peace. Peace is the noble purpose of the United Nations. And I greet you in the expectation that on today, the day of 8 billion, we can signal the possibilities of everyone living life in larger freedom, as promised by the United Nations Charter. I specifically would like to thank Partners in Population and Development, PPD, who have been there since Cairo to the present, and my own colleagues at UNFPA for organizing this very special high-level panel, and we know we're going to learn something new and helpful here today. It is an honor to join hands with all of you as we collectively focus on accelerating progress on family planning. UNFPA is the United Nations Sexual and Reproductive Health Agency, and we are proud to champion the global drive to reach zero unmet need for family planning by the year 2030, in keeping with the United Nations Sustainable Development Goals, those SDGs. And every year, UNFPA, a world leader in family planning, ships over 1 billion contraceptives around the globe. Last year, we helped people avoid nearly 13 million unintended pregnancies. And we're motivated by the principle that all human beings have the right to decide freely whether, when, with whom, how frequently to have children. And that simple conviction is enshrined in international human rights frameworks. For more than half a century, it has been reaffirmed many times over, up to and including the Cairo International Conference on Population and Development, ICPD, Program of Action. Yet we have to ask, why is it that still, for too many women and girls, that right remains elusive? As we meet more than 250 million women who desire to avoid pregnancy are not accessing safe modern methods of contraception, and among them, 172 million are using no method at all. So if we're going to get to zero unmet need for contraception in a short 7 to 8 years, we need to pick up the pace. And today, the day of 8 billion, we can ask ourselves, what's going to be significant in terms of moving the needle? How can we be the inclusive partners for people with disabilities, for refugees, migrants, internally displaced people, and for those young people who need correct comprehensive sexuality education if they're going to be able to responsibly exercise sexuality? And the good news, of course, is that there is a wealth of knowledge and expertise to help women, to help that adolescent girl better plan her family, and ultimately to save her life, as Mr. Chair has given statistics from Bangladesh showing improvements that family planning can bring on the ground. And this is where South-South and triangular cooperation comes in. When it comes to family planning, countries of the Global South have gathered valuable technical know-how and expertise, and they're eager to share these lessons and to help other developing countries overcome the barriers they're facing. So we need to listen to them, heed their advice. That knowledge is actually a treasure trove when we think about national agencies that are looking to advocate for family planning policies and programs, for expanding access to family planning services, and for improving the quality of those services. South-South and triangular cooperation is highly effective in mobilizing domestic financing and in securing adequate resources for family planning objectives. More and more national agencies are operating as centers of excellence in South-South and triangular cooperation. They're capable of mobilizing resources. They're capable of pursuing partnerships with counterparts in other countries where it makes sense to be allies. This is a development tool that we want to lift up because it's a win-win for everyone, and it offers substantial returns. There was a study conducted right here by the government of Thailand, and we may hear more about this, that for each dollar invested in maternal health, South-South triangular cooperation, the return was $4 in social benefit. So that's a social bet that we need to take. For UNFPA, what we've done is we have a dedicated unit, and its purpose is to champion South-South and triangular cooperation. And it's overseen by my colleague, our panel moderator, Mr. Arthur Erkin. And we count SSTC among those key accelerators for the achievement of our 3 zeros. The 0 of unmet need for family planning, 0 preventable maternal deaths, and yes, 0 gender-based violence and harmful practices. And I'd like to thank the Vice President of Zimbabwe, Your Excellency, for pointing this out and talking about men's support for gender equality last night. It was well appreciated. So I will close, dear guests, dear friends, by saying that in our discussions here at this international conference on family planning, but especially when we're home speaking to our stakeholders, to our decision makers, to the women and girls directly, let us not forget that we proudly hold high the banner of contraceptive rights and choices. It means a better life for women and girls and families. For that young woman or adolescent, for that girl in Africa, in Asia, in Latin America, in the Caribbean, in Eastern Europe, anywhere in the world, if she wants to access family planning, to pursue planning her life, planning a better life for herself, for the children to come, for her parents, for her community, the issue should be what is vital for her and how can we welcome her? How can we welcome her? How can we be adolescent and youth friendly? And together, I'm sure that we can figure out how to equip her with the information she needs, with the services she needs, and she will chart her own destiny for the betterment of all. And I would like all of us, my plea for you, be vociferous, be vocal, stand up and be counted, demand that we be better organized and cooperate. South-South and triangular cooperation is based on cooperation. So let us set the clock forward, not backwards, for gender equality for women's well-being. It is said that it is only in winter when we know which trees are evergreen. To me, you have been that evergreen tree. You have taken an interest in fairness, in the beautiful human relationships that childbearing, human sexuality should symbolize. And the hard decisions that you take every day, I believe, will lead a woman to be able to exercise her rights, her choices, her responsibilities. And if we pull together, even after COVID, even in the face of the financial issues, the conflicts, the climactic shocks, our adolescent girls will be able to stay in school, secondary education, so protective, and escape the cycle of poverty. Thank you very much for collaborating with us, and we appreciate that you have chosen to be on the day of 8 billion, sharing your expertise and knowledge with us and with each other. Thank you very much.
Thank you so much, Natalia, for this powerful statement, really, and highlighting the importance that we attach to South-South and triangular cooperation to reach one of those still elusive goals of unmet need for family planning, and why it is so important that we're doing it, and that in this year, 2022, it is not right that 250 million women still waiting for that promise of Cairo to decide for themselves when and how many children they want to have. So thank you so much, Natalia, for that. Now it's my honor to invite His Excellency, the Honorable Dr. C. Chiwenga, Vice President of the Republic of Zimbabwe, to deliver his statement. Dr. Chiwenga, the floor is yours.
Thank you, Arthur, our moderator. Our host Ministry of the Public Health of the Royal Kingdom of Thailand, as represented by Director General Swanachin, by Dr. Swanachin, honorable ministers, and fellow panelists who are here, partners in the population and development representatives, United Nations Population Fund, Executive Director Dr. Natalia, my neighbor here, Kanem, distinguished delegates, you will excuse me, but I will try to pronounce the Thai, Swatidi, Karap. Good, good afternoon. It is an honor and pleasure to join you today on this panel discussion on this important topic of South-South and triangular cooperation for family planning. First and foremost, let me thank partners in population and development and the United Nations Population Fund, which is the United Nations Sexual and Reproductive Health Agency, for organizing this panel discussion. In the same vein, let me also thank the Royal Thai government for hosting us in this beautiful country and the seat of Pattaya. The government of Zimbabwe, through the Ministry of Health and Child Care, has long been committed to providing and continuously improving access to contraceptives, to contraceptive services to its citizenry since the attainment of its independence and establishment of the Republic of Zimbabwe. The enactment of the Zimbabwe National Family Planning Act of 1985, just 5 years after our independence, and the establishment of the Zimbabwe National Family Council demonstrated the high commitment by my government to offer family planning services as part of primary health care. The Zimbabwe National Family Planning Council is an independent agency and mandated to coordinate. In fact, they regulate, coordinate, monitor, and take leadership in the provision of integrated reproductive health and family planning services. The agency is also the country coordinator for South-South cooperation for Zimbabwe. To show how seriously we take this human rights issue of family planning service provision, the board of the Zimbabwe National Family Planning Council is appointed by and reports to me as the Minister of Health and Child Care. May I hasten to say, ladies and gentlemen, that the head of state and president of the Republic of Zimbabwe takes the performance of agencies such as the Zimbabwe National Family Planning Council seriously. In this regard, the board chairperson and the chief executive, who are here present with me, sign their annual performance contracts in front of His Excellency the President. They have to do them every year. with quarterly appraisals done in order to track performance. I will continue to ensure that Zimbabwe's commitments are included as outputs in the performance contracts of our Zimbabwe National Family Planning Council leadership. Distinguished guests and delegates, in a bid to enhance the achievement of commitments of the International Conference on Population and Development, the government established a multi-sectorial national task force which periodically meets to regulate, coordinate, monitor, and evaluate the implementation of the program of action. The task force employs a whole of government and whole of society approach to ensure that all stakeholders contribute towards meeting the commitments we have made. The existing National Family Planning Forum, as well as the Sexual and Reproductive Health Forum, coordinates and provides technical leadership in all service providers in the country. Through these platforms, public-private partnerships have been developed and implemented, leading to improved family planning and reproductive health service provision for our citizens. Ladies and gentlemen, you may wonder why I am paying so much attention to local, within-country coordination of family planning players in my country. When you have asked me to talk about South-South and triangular cooperation, it is because I strongly believe that solid, tried, and tested coordination within a country sets up a strong base for successful establishment and implementation of both South-South and triangular cooperation. I am honored to testify that Zimbabwe has benefited tremendously from South-South cooperation. In 2022, Zimbabwe replicated lessons learned from the Ghana Adolescent Sexual and Reproductive Health Project. The program trained school health clubs and service providers on sexual reproductive health, and this helped to increase the uptake of sexual and reproductive health services. Through South-South and triangular cooperation with other nations, Zimbabwe has managed to fill gaps in the health service provision. This was achieved through exchange programs where medical and other health specialists from partner countries came into the country to provide services. Through South-South and triangular cooperation, Zimbabwe benefited in human knowledge and capacity building. Periodic fellowships offered by partners in population and development have seen various members of our health workforce obtaining postgraduate qualifications. Another partnership is on the training and learning on postpartum uterine contraceptive devices, commonly known as the loop, through triangular cooperation between Uganda and the UNFPA and my country. Honorable ministers and fellow panelists, Zimbabwe has not only benefited but also contributes to the body of knowledge for fellow member countries through South-South and triangular cooperation. There has been operational research prompted by the need to solve common problems and also address knowledge gaps. For example, at this international conference on family planning, Zimbabwe is sharing its findings and recommendations from research projects that include the following. 1, increasing access to family planning services for people living with disabilities. 2, assessment of access to and uptake of integrated menstrual health and hygiene management services by women residing in urban areas of Zimbabwe. Therefore, ladies and gentlemen, having seen and enjoyed the benefits of South-South and triangular cooperation, how can we move forward and leverage on it for even more gains? In Zimbabwe, there are various challenges that we are facing in the area of family planning and sexual and reproductive health, and indeed, the health sector as a whole. We believe these can be tackled through South-South and triangular cooperation. Let me briefly share a few of them with you. 1, the common problem of health worker attrition from developing to developed countries. My country invests so much in the training of doctors, nurses, laboratory scientists, and radiographers. However, most of them are poached by developed countries. Consequently, this is one big problem that applies to most of us here. It is only by getting together through multi-country South-South and triangular cooperation that we can sustainably address this problem. We are saying it takes 72,000 United States dollars to train a doctor every year, not until he completes, but every year the government of Zimbabwe pays 72,000. But at the end of the day, after 7 years of spending that money and tutoring, then that specialist is taken away. That's what we are saying. 2, we can embark on a multi-country collaborative research to answer operational questions pertaining to family planning and sexual and reproductive health. 3, it is also critical to embark on research and development for local manufacture of contraceptives and commodities that address the needs of our population. This surely will be a good way to further reduce the unmet need for family planning in our countries. And 4, another area of cooperation is data compilation, monitoring, and evaluation to inform policy and decision making. And more importantly, we need 5, we need to include all sexes, men and women, and girls and boys, if we are to win this battle to include for inclusive family planning provision. Furthermore, it is prudent to avail all methods of family planning, including abstinence, to ensure a comprehensive list of choices for our citizens, thus ensuring that no one is left behind. So all methods must be put on the table, and thorough education must be done, and training, and obviously that training to be effective, we need specialists in that area to train and educate our citizens. Ladies and gentlemen, let's put our heads together so as to come up with a comprehensive list of issues that can be addressed through South-South and triangular cooperation. The time to act is now. And what we have done which we have failed to do, we should take it to be behind us. And let's act now. I would like to remind each one of us that increased engagement to the international community in the South-South cooperation will unlock more resources for developing countries to pursue their national development plans and to meet the Sustainable Development Goals. Ladies and gentlemen, let me conclude by repeating the famous old saying that I shared with you yesterday. If you want to go fast, go alone. But if you want to go far, go together. Kwaukun, Kirap, thank you.
Thank you. Thank you so much, Your Excellency, the Vice President of the Republic of Zimbabwe, for your real powerful statement, and really highlighting the three conditions under which South-South and triangular cooperation can really flourish in a country, which is first political commitment, accountability, and of course, as I said, internal cooperation. It's only through those three that it can really come to fruition. I think it was a powerful reminder, and of course, you also highlighted the problem that many countries face, and it's the brain drain that countries face, and how can we overcome that through South-South and triangular cooperation. We're now going to hear a recorded statement by His Excellency Dr. Yu, the Vice Minister for National Health Commission of the People's Republic of China. Dr. Kanem, by the way, will leave. She has another engagement, but Jenna Keita, the Deputy Executive Director of UNFPA, will sit in her place. So, thank you so much. Yeah, sure. And so we're going to hear from Dr. Yu, once again, Vice Minister, National Health Commission of the People's Republic of China.
尊敬的各位部长、各位同事、女士们、先生们，大家好！很高兴有机会参加本次计划生育南南合作与三方合作部长级论坛，同大家一同交流探讨加强人口和计划生育领域的南南合作与三方合作，共同推动实现内罗毕承诺和2030可持续发展目标。正如我昨天在第19届人口与发展南南合作部长级会议发言中指出的那样，中国始终高度重视人口与发展问题，坚持人口与发展综合决策，在实现国际人发大会行动纲领和2030可持续发展议程目标方面取得了积极的进展。到2020年底，中国在历史上第一次全面消除了绝对贫困，近1亿贫困人口实现脱贫，对全球减贫的贡献力超过70%。中国的人均期寿命达到78.2岁，孕产妇死亡率、婴幼儿死亡率等主要健康指标优于中高收入国家平均水平。中国始终是南南合作与三方合作的坚定支持者、积极参与者和重要的贡献者。最近，习近平主席在中国共产党第20次全国代表大会报告中强调，中国愿意加大对全球发展合作的资源投入，致力于缩小南北差距，坚定支持和帮助广大发展中国家加快发展。我们相信，走上新征程的中国将为各国发展带来更多的机遇，为人类进步做出更大的贡献。当前，新冠肺炎疫情持续存在，地缘政治冲突不断，世界经济复苏不确定性加剧，世界各国，尤其是发展中国家，更需要守望相助，团结合作。主席、各位部长、各位同事、女士们、先生们，面对新挑战、新形势，中国愿与广大发展中国家和国际社会一道，加强计划生育和生殖健康领域的交流， 深化计划生育南南合作与三方合作，为加速推进实现国际人发大会行动纲领和联合国2030可持续发展议程目标而共同努力。谢谢。
We thank Dr. Yu, and through him, the People's Republic of China for being such a strong supporter of South-South and Triangular cooperation, both financially and otherwise. I want to thank him for that. I now have the pleasure to invite His Excellency Dr. Dereje Duguma, State Minister, Ministry of Health of the Federal Democratic Republic of Ethiopia, to deliver his statement. Dr. Duguma, the floor is yours.
Thank you very much, Arthur. His Excellency Dr. Chwenga, Vice President of Republic of Zimbabwe, His Excellency Mr. Zahid, Minister of Health for Republic of Bangladesh, Excellency Dana Kete, Deputy Executive Director for UNFPA, dear Ministers, UN representatives, government representatives, PPD Chair, board members, ladies and gentlemen, it's an honor to speak on this important platform, on this ministerial panel, where stakeholders on population development are convening. And this is a perfect opportunity for member countries to learn from each other, to share experiences, and to progress forward on the cooperation among South-South and also on triangular cooperation. The South-South and triangular cooperation is a well-recognized development mechanism, and it focuses on different areas of cooperation. And I believe family planning will be one of the most important area where the cooperation focuses and where the countries could learn from each other. And this cooperation has gained momentum since the second high-level UN conference on South-South cooperation in 2019. And as member countries already mentioned, we are benefiting a lot from it. I want to concur what the Vice President of Zimbabwe rightly mentioned, the progress that have been achieved through the cooperation where member countries are benefiting. I want to share what have been rightly said, and Ethiopia is one country that benefited from the cooperation. I would also want to share what the minister from China rightly mentioned, especially during COVID-19, the support that member countries received from each other is an exemplary support. I can mention the support that we got from China during the early pandemic time, where all countries prioritized their own interest. So China have been supporting countries including Ethiopia by PPEs and many other drugs and commodities. We can also mention the vaccine issue from India and also many other countries. And Ethiopian Airlines, as you know, is one of the most strong airlines that we had in the soil of Africa, have been supporting by distributing drugs and vaccines to many African countries. So we have a big opportunity. If we come together, if solidarity is there, I'm sure we can prosper together as in the cooperation. So I want to share what previous speakers have already said on this important partnership among South-South. I just want to speak on three areas. The first one is I want to share experiences we had specifically on family planning from Ethiopia. And the second one will be the challenges that we should work together to alleviate. And the last one will be our commitment and also our expectation from PPD and also from the cooperation in general. I fully believe that countries in the South have vast experience in expanding family planning services to the lowest, most available facilities. From Ethiopia, we have a very important platform. We are working through primary health care, and we have been investing in primary health care over the last several years, and we have also benefited from that one. And one of the area where we invested was postpartum IUCD training and availing the service at health post level. So the lowest health facility in Ethiopia is health post. We have one health post for 5,000 people, and it is staffed by 2 health extension workers, and these health extension workers are trained to insert implants. So this is very important for us to improve, thank you very much. So, I mean, this is very important for us to make the availability of this service at that low level. So I think member countries can also learn from this one. The other important experience that we had, especially over the last 3-4 years, is postpartum contraception, especially in IUD and also in implant. Our colleagues from Zimbabwe has rightly worked on this one too. So especially in health centers and the hospitals, I mean, in Ethiopia, we have more than 3 million births every year. So Ethiopia is one of the countries with rapid population growth. So we are working seriously now on postpartum IUCD for implant and also for IUDs, and it's progressing very well. And the achievement is, especially this time, we are jumping to like 10% of the achievement is. So, I mean, this will improve our long-acting family planning methods, and I mean, it is through long-acting family planning methods that we can sustainably improve our CPR. So this is one of the experience we had. The other most important experience is the data system. So we rely on data to make an informed decision, and we are actually utilizing the DHIS2, the system, I mean, you know, the routine system of collecting data, analyzing, and using for decision. I think that's progressing very well, but we also rely on other surveys to triangulate our data and also to timely inform the leadership at all levels. So PMA, performance monitoring for action, is being conducted every year. We also have different surveys and research, implementation researches. So these are trying to inform us where we are and what we should work seriously. Another important issue is aligning at all level. So specifically for family planning and also for reproductive health issues, the one plan, one budget, and one report mechanism is there. Alignment in the sector, alignment with other sectors, and also alignment with partners is progressing very well in Ethiopia. So UNFPA and the other partners working especially on family planning and other reproductive health are aligning their annual and strategic plan to ours. So I think these are some of the experiences we had. But the most importantly, one of the most important part of this discussion is enhancing, improving domestic resource mobilization for securing commodities, family planning commodities. I mean, this is very important, especially this time. So we have been discussing in different panels, different areas on this matter. So Ethiopia has already signed the compact document. And I truly say that this is the start of our commitment. Otherwise, the government of Ethiopia is committed more than any time to secure family commodities at all levels. So we are going beyond the commitment, and we have started to invest from SDG pool fund, from treasury at national and also at regional level to enhance the financial mobilization and also strategic procurement for this matter, and will continue to match from the government side. And finally, thank you. Finally, one experience we had recently, we started adolescent and youth health to be scaled up at all level. So every year, our Prime Minister is making a big youth forum that focuses on economy, social inclusion in a meaningful way. That is one important thing. But also, sectorally, we are working on engaging our users at all level. And also, we are working seriously now in industrial parks where many youth, especially adolescent girls, are working to engage them meaningfully and to avail health services wherever they work. So I think member countries, we can learn on this matter. I have also noted what other countries in the south have worked in improving family planning and SRH activities. So we are ready to learn from other countries. The challenges, the few challenges. The first one is inequity is still a major hurdle that we have to work together. The difference between performances of the urban and the rural area, the poor and the health is still there. We have pastoral communities, and access in those areas is still a problem. So, I mean, these are areas where we can support each other and we can learn also experience from each other. Other important issue is quality of family planning service, especially quality counseling is a backbone for family planning advancement. So our health workers should be well informed about that one. That is something we need to do more. And of course, sustainable financing for family planning commodity security is another challenge that we have to work together. And finally, our expectations from the cooperation and also from PPD will be, the first one is, I mean, to maintain the success that we had so far, and also to improve to alleviate the challenges. We expect to have center of excellences in member countries. So we have started this one in one of our big hospitals. We have one center of excellence that works on quality, and I mean that's the center which excels in quality RH services and also in terms of educational capacities. So we are also trying to link this center to other 9 big universities that work on RH activities, especially on focusing on family planning. We have also started family planning subspecialty fellowship. So we need to have at least few specialty centers in countries. And those center of excellences among member countries can learn from each other. They can form a network. They can learn from each other. And I believe the cooperation, especially PPD, will work on this one. And these centers, if they get some finances, they can also work on data generation. They can work on surveys, implementation, researches. So I mean, it's very difficult to support all facilities or all member countries at a time. But we can at least select some center of excellences, and we can take those center of excellence as a model facilities so that other facilities and universities can learn from. The other important issue I want to raise is we have to bring the country office forward. I mean, country offices in all member countries, especially with the relations that we had with PPD, should be elevated a little bit. So we need to have a team that works in each country. The communication between country office and headquarters in Bangladesh, and also the communication with the country office with partners, especially with UNFPA and also other partners, should be a little bit strengthened in country offices. So we are so much committed to work on this one, but PPD and the cooperation should also at least work on these issues. And one last point that the vice president of Zimbabwe rightly mentioned, I want to second that one. I mean, we need to have local manufacturing of family planning commodities in the south. At least we can think in blocks of countries. We shouldn't always import those important and life-saving commodities from somewhere else. We need to produce them. And for Ethiopia, the government of Ethiopia has prioritized local manufacturing this time, and the investments and the support from government this time is is progressing very well. So, I mean, the cooperation, especially PPD, can work on this one. If we get technical and financial support, I mean, we are so much welcome. There is a welcoming political environment now from our side. In saying this one, I want to reaffirm the commitment of government of Ethiopia toward the South-South and a triangular cooperation. We are committed to technically and financially support this cooperation. We are part of it, and we prosper together. And Ethiopia is there to support and to share experience and also to learn from other countries. I thank you.
Thank you. Thank you. Thank you very much, Dr. De Guma, for also acknowledging the support Ethiopia received during the COVID-19 from other countries in the south, but also your expectations for PPD, which is, of course, a highlight to the need for centers of excellence in the countries themselves, the member states, the member countries of PPD, and, of course, the need for local production of contraceptives and other means to be less dependent on others. With that, I have the honor to invite His Excellency Mr. Amos Lugolobi, the Minister of State for Finance, Planning and Economic Development of the Republic of Uganda, to deliver his remarks.
Thank you so much, Mr. Moderator. His Excellency Dr. Chiwenga, Vice President, Republic of Zimbabwe. our event, our panel chair, His Excellency Mr. Zahid Maleku, Minister of Health and Family, People's Republic of Bangladesh, Dr. Natalia Kanem, Under Secretary General of the UN and Executive Director, UNFPA, who is now represented by her deputy. Our host, Dr. Sunawacha, Director General, Department of Health, Minister of Public Health, Kingdom of Thailand. Our fellow panelists, distinguished ladies and gentlemen. The Republic of Uganda aligns itself to the program of action of the International Conference on Population and Development that was held in Cairo, Egypt in 1994, where diverse views on human rights, population, sexual and reproductive health, gender equality, and sustainable development were merged into a remarkable global consensus that placed individual dignity and human rights at the very heart of development. 20 years later, since then, the Republic of Uganda can proudly claim that the ICFP has worked for the millions of women and girls in our country. Our maternal mortality ratio, that is the number of women dying due to pregnancy-related causes, has dropped significantly. And in my government, policymakers at national and district levels, as well as religious leaders, put women's fundamental rights at the heart of their daily decisions. As a result of the South-to-South Triangular Cooperation and the partnership with UNFPA and other donors, Uganda has seen tremendous improvements in life expectancy, presently at 64 years, up from 46 years a few years ago. We have seen improvements in infant mortality, now standing at about 40 per 1,000 live births, and maternal mortality at about 300. It used to be almost close to 1,000 per 100,000 births. It's now below 300, among others. Uganda has drawn clear and focused roadmap to harness its demographic dividend. At the historic Nairobi Summit on ICPD 25, about the accelerating the promise, the government of Uganda made commitments aimed to galvanize change and drive the country's vision for social transformative change and geared towards the achievements of the Sustainable Development Goals, SDG. The country launched the family planning in 2020, commitments as a framework towards rights-based family planning. Now, building on the achievements and momentum built as a result of Uganda's commitment to family planning 2020 partnership, the Sustainable Development Goals and renewed global strategy for women's and children's health, the government of Uganda undertook the following new commitments under the Uganda Family Planning 2030 commitments. Number one, the government commits to increase the modern contraceptive prevalence rate for all women from 30.4% in 2020 to 39.6% by 2025, and reduce unmet need from 17% in 2020 to 15% by 2025. Number two, noting that Uganda is one of the youngest countries in the world, the government of Uganda recommits to annually allocate at least 10% of maternal and child health resources to adolescent responsive health services by July 2025. Number 3, Government of Uganda commits to annually ring-fence 50% of the domestic resources allocated for procurement, warehousing, and distribution of family planning commodities from the reproductive health commodities budget about the supply of reproductive health items by 2025. Number 4, the government of Uganda commits to improve family planning data quality through ensuring use of diagnostic health survey tool, health management information system data for decision-making at service delivery points in the public and private sector. And finally, number 5, the government of Uganda commits to improve quality of family planning counseling. In other words, available planning options, possible side effects, their management and switching among SDPs, community health workers, and peer-to-peer from the current Method Information Index Plus of 42% in 2020 to 60% by 2025. Uganda recognizes that attainment of these commitments further requires South-to-South and triangular cooperation, and therefore appreciates all the support from partners in population and development and the United Nations Population Fund for unwavering support in the application of SSTC partnerships that have helped the country leverage from more impactful and sustainable actions at a global, regional, and the country levels, and have helped Uganda get on the trajectory towards harnessing the demographic dividend. We thank you so much, and thank you so much for your attention.
Thank you so much, Your Excellency, for highlighting the many successes of Uganda over the last few decades, as well as the renewed commitment to this agenda and the need, therefore, to have South-South and triangular cooperation to be successful in the future. But thank you so much for highlighting those successes of Uganda. I now have the honor to invite His Excellency Professor Rizal Damanik. He's the Deputy Chairman for Training, Research and Development in the Indonesian National Population and Family Planning Board, better known as BKKBN. And I'm also especially honored to welcome him because the BKKBN this year received the UN Population Award for the many successes it has had in Indonesia. So it is my pleasure, Professor Damanik, to give you the floor.
Thank you, Arthur, for a nice introduction. Assalamualaikum warahmatullahi wabarakatuh. So His Excellency, Mr. Vice President of Zimbabwe, Dr. Ziwenga, Dr. Natalia Kanim, the UNFPA Executive Director, His Excellency Dr. Zahid Malik, the Chair of Decisions, and Dr. Suwana Chai, the host. Ladies and gentlemen, it is a great honor and privilege to be with you at this ministerial panel on South-South triangular cooperations on family planning in Pattaya, Bangkok. And on behalf of the government of Indonesia, I'm delighted to participate in this event. So first of all, allow me to begin by extending my sincere thanks to the PPD members countries for congratulating BKKBN as the laureate of the 2022 United Nations Population Award. I also wish to extend my congratulations to the chair of the PPD board for organizing this event and express my felicitations to all executive committee members, board members, and PCCs present today. Excellencies, ladies and gentlemen, looking back Indonesia South-South cooperation was built upon notions of solidarity, win-win, and mutual benefit based on the spirit of the famous 1955 Bandung Conference in Indonesia. This narrative have shaped a model of Southern cooperation that is continually evolving. The Asian African Conference is the starting point for good cooperation between developing countries known as the South-South cooperation. The government of Indonesia has extended grants and contribution to the South-South cooperation for a long time through ministries and agencies, including the National Population and Family Planning Board of Indonesia, or BKKBN. BKKBN's contribution to the South-South cooperation has been implemented through program development and knowledge sharing with other countries. The success story of the BKKBN in the family planning program brings favorable changes in Indonesia demography, primarily the significant reduction of the national fertility level-wide and acceptable population growth rate translate into a higher gross national product per capita, which translate into higher incomes, higher savings, and higher investments, and brings improvement in the standards of living of the people of Indonesia. This success story has attracted the visit of overseas practitioners from various countries. Since the 1980s, Indonesia, through BKKBN, has been sharing its unique case and best practices on family planning, reproductive health, and program to more than 5,000 practitioners from 100 countries from Asia Pacific, Africa, the Middle East, developed countries, and representative of international agencies under the framework of South-South cooperations. Excellencies, ladies and gentlemen, to continue promoting South-South cooperation through knowledge sharing and best practices, BKKBN developed 7 thematic pieces of training in 8 selected provinces as the Center of Excellence International Knowledge Hub in 2021. The training topics are, first, training on quality family village in Yogyakarta and Bali provinces, training on supply chain management in the South Sulawesi province, the third, training on adolescents' reproductive health through generation planning program in West Java and South Sulawesi provinces, fourth, training on the role of Muslim religious leaders in family planning in East Java province, training on microdata management, family survey in Jakarta and Central Java, training on postpartum family planning programs in East Java and South Sulawesi province, training and comprehensive family planning service in Jakarta and Yogyakarta provinces. In addition to 7 training topics, BKKBNs also organize pieces of training that are demand-driven, in which the training is tailored to the needs of the participations. Government officials, employees of international organizations, students, and educators may request a customized training program on issues related to the populations, family planning, reproductive health, and development. Ladies and gentlemen, BKKBN has also conducted various training under the framework of such cooperations. For example, this year, BKKBN has already implemented 4 components of training: supply chains management for the Philippines, Muslim religious leaders in family planning for Asia and Africa countries, and bridging leadership in family planning. Last week, we just had successfully implemented training for 40 delegates from Afghanistan who came to Indonesia to learn about the implementations on maternal, child health, and family planning programs in Indonesia. Excellencies, ladies and gentlemen, I believe that every country has its experiences and best practices as well as innovations that other countries can apply. South-South cooperations and knowledge sharing can provide a common platform among developing countries. This mutual platform can bring together countries to find solutions to common problems. Nowadays, technology allows us to meet everywhere so that knowledge sharing can be done easily and cheaply. Therefore, advancing South-South knowledge sharing among developing countries, especially among PPD countries, should be carried out intensively. In closing, the KKBN reiterates the need to strengthen and boost cooperations among countries, especially PPD countries, under the framework of South-South cooperations. BKKBN stands ready to advance collaborations and to share best practices among developing countries, especially PPD member countries, to address common issues and to achieve the ICPD plan of actions, ADGs, and 3 zeros. BKKBN looks forward to furthering discussion to reiterate its commitment to improving the quality of lives of the people and their rights. I thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Professor Dominique, for not just highlighting the impressive role that the BKKBN has played in promotion of family planning in Indonesia itself, but also the impressive role that BKKBN plays in South-South and Triangular cooperation. It really is a center of excellence, and of course, call upon all of the member countries of PPD to take note of the capacity that BKKBN has. We are about half an hour late, but nevertheless, it would be remiss from us not to listen to two more speakers. The first is Dr. Leticia Adelaide Apia. She is the Executive Director of the National Population Council of the Republic of Ghana. Dr. Apia, the floor is yours.
Thank you, Arthur, for the floor. Chair, Minister of Health and Family Welfare, Bangladesh, His Excellency, Vice President of Zimbabwe, Ms. Diane Katie, Deputy Director, UNFPA, representing the Director, delegates, honorable ministers, guests. Today, 8 billion person is born. And so I greet you with health, peace for all, and hunger for none. I want to say that Indonesia, as just represented, we, through South-South cooperation, have benefited virtually, knowledge sharing. Last year, we had our first demographic summit in Ghana, and we invited Indonesia, Senegal, and Rwanda. And so South-South cooperation, it's really working and helping everyone. I want to start by saying that we're here because family planning and universal health coverage innovate, collaborate, accelerate, underscoring the role of family planning in achieving universal health coverage. Countries offer universal health care as basic human right to citizenry. However, data abounds that citizens of countries where family planning is prioritized live longer and healthier compared to those who don't. and is there for everybody to see. Family planning is thus central to individual well-being and national development and must be embraced by all. I dare say, prioritizing family planning actually operationalizes leaving no one behind in health, hunger, which starts from the first 1,000 days of your life, and poverty. When we talk about poverty, we always forget about time poverty. And family planning makes sure that time poverty is eradicated, because time is a non-renewable resource. And family planning is so key in that. It also means leaving no one behind in education, because when you are hungry, you cannot be educated. It means leaving no one behind in security. We have a lot of our presidents, Sub-Saharan African presidents, meeting to talk about security, forgetting that leaving family planning behind causes insecurity, because it causes unemployment. And so we have to know that. And then finally, leaving family planning behind, leaving no one behind, is actually leaving people out of dignity. And so for me, the line in leaving no one behind in the SDG goals is family planning. We actually did not go far with MDGs because family planning was not part. And so if we really want to meet the goals, it is family planning. In creating the Africa we want, so many of us are here, and moving my country, Ghana, beyond aid, central is family planning. And so in our country's quest to implement universal health coverage, the government took a decision to replace the then existing cash and carry system with the enactment of the National Health Insurance. That was in 2003, and subsequent operation of the scheme in 2004. Fundings were by so many sources, and it covered many people, 70 years and above, children 18 years and below. However, family planning was not included. So that is one lesson. You cannot have universal health coverage without family planning. It's like baking bread without the yeast. You'd never have bread. And so family planning was not included. And in the nation's quest to reduce high maternal mortality and morbidity, we started in July 2008 with a free maternal health policy. Free maternal health policy exempted pregnant women from paying. And so we had the full package covering comprehensive skilled birth attendance, antenatal, postnatal health care, and still did not include family planning in 2008. The National Population Council, CSOs, academia, and many, many stakeholders who I can see a lot of them here, advocated for integration of family planning as part of the package, as primary prevention of higher risk pregnancies. In our data, that data stood at 49%. So basically, half of the pregnancies were higher risk. It means go high speed, have an accident, and we will cure you. Basically, that is what it means, to have higher risk pregnancies and not try to prevent it. And we always forget the social and cost implications far beyond the health sector. Because the cost implications is not just in the health sector, it gets into education, it gets into housing, it gets into supply of everything. And so we advocated for family planning, both for the survival of the scheme and well-being of citizens, because it's more expensive to cure than to prevent. And so if we did not incorporate family planning, it means that the health bills were increasing. So we did that to save both the scheme and the citizens. Some indicators that led the advocates